sorry.
That's all right. That's why I taped it up there.
Yeah, you're a smart man.
It's hard to record without a lot of work.
Good. You good? Okay, great. Good afternoon, everybody. Today is Thursday, May the 7th. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners. I'm here with my fellow commissioners, Vice Chair Ken Lawrence, Commissioner Joe Gale, also Dr. Brenda Weiss, the Administrator for our Office of Public Health, and Dr. Al Wong, our Regional EMS Director, and Megan is here today translating for us. Since our May 6th press briefing, we have 105 new cases of COVID-19 in Montgomery County, which brings us to a total of 4,839. 40 of the 105 new cases today are from long-term care facilities. These positive individuals are from 31 municipalities, none of which are reporting new cases. So this keeps us at 61 of our 62 municipalities that are home to individuals with COVID-19. You can check the updated municipal maps at moncopa.org/COVID-19 for more information. Today we have 59 females and 46 males that were newly diagnosed with or tested positive for COVID-19. 2 of these individuals are known to be hospitalized, 6 are in isolation at home, and of course we have the group that is in the long-term care facility, and the remainder are unknown. I'm also saddened to confirm today that 14 more Montgomery County residents have lost their lives to COVID-19, which brings us to a total of 393 deaths confirmed positive from COVID-19. 4 of these individuals died in a hospital, 3 in a residence, and 7 we don't have information on. Today, these individuals ranged in age from 54 years old to 93 years old. In total, we've had 214 females and 179 males that have lost their lives to COVID-19. The self-identified racial breakdown: 12 are Asian, 3 are Asian Indian, 3 are Asian Korean, 34 are African American or Black, 108 are white, and 233 we do not have information on. In terms of probable deaths, and remember these are deaths that we do not have laboratory confirmation that they were actually COVID-19, but the death certificate listed COVID-19 as a cause of death. Sometimes we do subsequently get lab confirmation, in which case we do move these individuals to the confirmed positive count. So today we have 170 total probable deaths, which brings us to a total of 563 either confirmed positive or probable deaths. In terms of hospital beds today, we are now close to 375 hospitalized individuals across our 9 hospitals here in Montgomery County. This is a slight decrease from where we've been running, so this is great news. However, nearly 25% of them do continue to require a ventilator to help them have adequate oxygen levels. So the individuals who are hospitalized tend to be in pretty serious condition. And we certainly wish them the best and hope for a speedy recovery. Not surprisingly, we do continue to have hospital beds available thanks to your good work and your willingness to stay home and do your best to appropriately physically distance when you are out. This remains extremely important because if you've been following these hospital numbers at all closely, the people who are hospitalized tend to be hospitalized for a fairly long period of time, a high number of them for weeks. So while we do have hospital beds available, it would not take much to fill those beds and become part of these very large number of people who remain hospitalized with COVID-19. In terms of our long-term care facilities, today we have 93 facilities that are reporting positive cases of COVID-19 among their staff and residents. Today we have 1,307 cases among residents and 520 among staff, for a total of 1,827 people that have tested positive. Now, a reminder that these are not all considered Montgomery County residents, particularly among the staff, but we do these daily snapshots to help people understand how serious and challenging the situation is at many of our long-term care facilities. Today we have 325 of our 393 confirmed positive deaths of Montgomery County residents that are affiliated with a long-term care facility. So that is 83% of our total confirmed positive deaths. We continue to do outreach to these facilities. As of the end of the day yesterday, our FAST team, which is our Field Assessment and Support Team, has visited 60 of these facilities. Today they are debriefing, and tomorrow they have appointments or scheduled to visit 12 additional facilities. These visits continue to be very productive. They are offering guidance on infection control policies. They are making sure they have adequate personal protective equipment and that they're using that equipment effectively and correctly. We are continuing to recommend that they consider the testing of all people in their facilities as is feasible for them to do so. Our situation at our Montgomery County Correctional Facility remains stable. All of the inmates who have previously tested positive and were asymptomatic remain asymptomatic. Those who were positive and symptomatic continue to show improvement. So thankfully, we just remain stable there. All of these individuals are under close observation and continue to do well. Our community testing sites are both up and running. Both should be open tomorrow. Our Norristown walk-up community testing site that is available to residents of the municipality of Norristown will be open tomorrow from 11 to 1. You can make an appointment there beginning tomorrow morning at 8:30 in the morning by calling 610-592-0680. That's 610-592-0680. And again, they are testing people between 11 and 1. You do need to call for an appointment, but you don't need anything else. You don't need a doctor's order or health insurance. They will not run over the weekend, so tomorrow would be the last opportunity to be tested until Monday. Our Montgomery County Community College drive-through site is also open and running smoothly. They will be open tomorrow and Saturday. They will not be open on Sunday. To make an appointment for tomorrow, Friday, you can go online at 8 a.m. tomorrow morning at montcopa.org/COVID-19. Click on the green button that says County Testing Information and follow the directions there. Or you can call 610-631-3000. All right, so I have a couple of announcements today. Number one, I want to thank Governor Tom Wolf, who was joined by Attorney General Josh Shapiro today to announce that Governor Wolf has signed an executive order that protects Pennsylvanians from foreclosures or evictions through July the 10th. This action builds on a Pennsylvania Supreme Court order which closed court eviction proceedings until May 11th and ensures that no renter or homeowner will be removed from their home for 60 additional days. Again, that is until July 10th. I want to really thank the governor for taking this critically important step. This is very important to public health. I can't imagine a worse situation right now than somebody losing their home and having nowhere to go. So thank you to Governor Wolf for continuing this critical public health measure. I also have an announcement that our folks at Aqua Pennsylvania asked me to make today. Aqua Pennsylvania wants all of their customers to know that their water is safe to drink, but they have a particular piece of information that applies to buildings that have been completely closed and not in use due to COVID-19. And that announcement is that water that has been left sitting in unused pipes or equipment like ice machines or other building systems, because these buildings have been closed for an extended period of time, can become stagnant and produce undesirable tastes or develop odors. When that building is reopened, they have some guidance on how you should do that. They are suggesting that building plumbing, including water heaters, should be thoroughly flushed before reopening for normal use by flushing all cold water lines first, followed by flushing hot water lines. And again, this applies to buildings that no one has been in for the past several weeks. And as you're contemplating reopening those buildings down the road, and that is down the road, I want to emphasize, they have some guidance. So all the details and guidance can be found at Aqua's website, and that's www.aquaamerica.com. Again, www.aquaamerica.com. And I also want to note today that we are in the, I guess now toward the end of Mental Health Awareness Week. Certainly during these very challenging times, it is natural and normal for people to experience higher levels of stress. As we've said many times from this podium, it is okay to not be okay. We've had a lot of changing circumstances and information, sometimes within the same day. And so all of this change and uncertainty can contribute to depression and anxiety, as well as exacerbate other mental health conditions. Thankfully, here in Montgomery County, our offices of mental and behavioral health offer a full array of services and programs to help individuals of any age, at any time, and wherever you are. Our team is committed to providing participants with the highest quality of services, which are easily accessible, respectful of the individual and the family, welcoming, and focused on the unique needs of each person. Our services are still being delivered. They're being delivered with an integrated approach with the offices of mental health, drug and alcohol, developmental disabilities, children and youth, juvenile probation, our crisis services, and our other human services offices. During the COVID-19 social distancing order, online and phone support remains available from several of our services. You can visit our webpage at www.montcopa.org, click on Departments, and then under the Health and Human Services link, you can find information on online support during social distancing. So I just want to remind you that all those services are there, and thank all of our mental health team. They've been doing really fantastic work during this time to try to connect with people in any way that they can and in a way that's safe for everybody involved. Now, I just want to remind everybody, as I'm sure many of you are undoubtedly aware, that Governor Wolf's statewide stay-at-home order does expire tomorrow. However, I want to clarify this because I've received a number of questions about this. It is my understanding from the Pennsylvania Department of Health that as long as Montgomery County remains in the red phase, which we are still in, the stay-at-home order remains. So let me repeat that. Montgomery County remains in the red phase, and therefore the stay-at-home order does not expire for those of us in Montgomery County tomorrow, as it will for some other parts of the state. And so that brings me to Mother's Day. Mother's Day is Sunday, as I'm sure many of you know, and if you forgot, this is your reminder. Please plan to celebrate Mother's Day with appropriate physical distancing. I hope that you can find a way to connect socially that's appropriate and appropriately far apart. Let's keep our moms safe on this wonderful holiday. And with that, I'm going to turn over to Dr. Al Wong with some important reminders.
All right, thank you very much. So we have seen a decline in the number of patients coming to our emergency departments for strokes and heart attacks, even though these conditions should be occurring at about the same frequency without regard to the COVID-19 pandemic. In fact, we have some evidence that COVID-19 can actually increase the risk of abnormal clotting in the body, which increases the risk of stroke or heart attack. COVID-19 can cause these conditions to occur in young patients in their 30s and 40s rather than in their 60s and 70s when we're more used to seeing these types of conditions. Lastly, we have received reports of patients who have delayed coming to the emergency department or calling 911 with serious symptoms for fear of contracting COVID-19. This does match the data that we've seen from our 911 center with a decrease in calls for heart attack or strokes over the past 2 months. As a full-time emergency physician, my colleagues and I have spent years encouraging people to seek prompt emergency care for time-sensitive conditions such as stroke and heart attack. There is clear evidence that the sooner people call EMS or come to the emergency department for treatment, the better their chances for full recovery will be. When you call 911, our telecommunicators can give you simple instructions over the phone about how to help the victim. Our EMS workers are highly professional and well-trained. They are equipped with the latest information, technologies, and treatments to bring many aspects of emergency department care right to your front door, and they can continue those same treatments during their transport to the hospital. And although it's important to keep 911 ambulance services in the emergency department available for emergencies, if you are having serious symptoms such as chest pain or signs of a stroke, please don't wait at home to see if things get better. Call 911 right away. Since May is National Stroke Awareness Month, I wanted to take some time to review the symptoms of stroke, and we use the mnemonic "Be Fast" to help us remember what these signs are. So if we can look to my left, B is for balance, and so any sudden loss of balance or coordination could be a possible sign of stroke. E is for eyes, so any loss of vision in one or both eyes or blurred vision is another sign as well. F is for face, so any weakness in one side of the face or asymmetry or facial drooping. A is for arms or legs, so any weakness in one arm or one leg is a very concerning symptom. Speech, slurred speech, difficulty in finding words or confusion or comprehending words. And last is time. So if any of these symptoms are present, it is time to call 911 right away. Take note of when the symptoms started, as that's very important for the emergency physicians to be able to initiate treatment. And most importantly, time is brain. In the United States, every 40 seconds somebody has a stroke, and for every minute that treatment is delayed, as many as 2 million neurons can die. And when you get to the emergency department, our emergency departments are fully prepared and capable of carrying patients with or without COVID-19. We have infection control and disinfection measures in place to minimize the chance of contracting COVID-19 for anybody in the department. Our staff members are ready and able to care for you if you're having an emergency. You're not imposing on us, so please don't delay in seeking care for serious emergencies. And on behalf of our public safety professionals, EMS workers, and hospital staff members, please allow me to express my sincere thanks to all of you for the individual sacrifices that you have made over the past weeks to flatten the curve. Let's be smart and help each other out. We'll all get through this together. And with that, I'd like to turn over to Commissioner Gale.
Good afternoon, everyone. I'm Montgomery County Commissioner Joe Gale. On May 5th, 1984, President Ronald Reagan proclaimed the first full week of May as National Correctional Officers and Employees Week. These courageous law enforcement professionals represent one of the most important components of America's criminal justice system. They ensure order, disrupt violent confrontations, and also work to help rehabilitate prisoners. They exemplify professionalism, integrity, and strength in the face of a difficult and often dangerous work environment. According to the U.S. Bureau of Labor Statistics 2018 report, there are more than 453,000 correctional officers working in the United States. The Montgomery County Correctional Facility and the SCI Phoenix Prison employ 1,200 and 360 total employees, respectively. Within local jails, state prisons, and federal penitentiaries, correctional officers serve as the voice of authority while also ensuring their personal safety and the safety and welfare of prisoners and staff. Correctional officers have one of the highest rates of illnesses of all occupations, often resulting from interactions and confrontations with inmates, which has been exacerbated with the current COVID-19 disease spread. In addition to maintaining order and safety, they now have the additional responsibility of helping to reduce the spread of COVID-19 within the prisons. Please join us in celebrating National Correctional Officers and Employees Week by extending your gratitude for the service and commitment to duty of these individuals. We pray for their continued safety as we honor those who have given their lives protecting and serving our nation. And with that line, protecting and serving our nation, I'd like to comment on a recent issue that has come to surface here in Montgomery County, and that's the failure of Montgomery County government to distribute and supply American flags to various community organizations, including several veteran organizations, that we are legally obligated to each year to supply American flags to them so they can display them at cemeteries across Montgomery County. I was in support of providing these flags to all these organizations. This is 59,000 flags, which we already have. They're already purchased, and they're literally sitting in boxes here at the county. But I was outvoted 2-1 to provide these flags to the various organizations that typically display them at cemeteries. The reasoning behind this is there's afraid that it could spread COVID-19. I have the opposite opinion. I think that I have faith in the citizens of Montgomery County, the residents of Montgomery County, that they can safely display flags at cemeteries. It's outdoors. If they want to wear a mask, they can wear a mask, and they can do it safely. We've provided so many guidelines over the course of the last 10 weeks about the importance of hygiene, wearing masks, social distancing. I have faith that the people of Montgomery County know what they're doing and can safely honor our veterans that made the ultimate sacrifice and unfortunately died protecting our American freedom. And I'm blown away by what's happened here in Montgomery County. I find it highly disrespectful, and it's a slap in the face to law-abiding citizens that want to honor and respect our veterans that made that ultimate sacrifice. So I want the public to be clear that I was in favor of this. I'm disappointed that you don't have the opportunity to have the flags we already have in hand to honor our fallen heroes. Also, when we first learned about the coronavirus, there was many uncertainties around this virus, and there still are many uncertainties. But there were two factors that we did know. One, around the world, when other countries first experienced the outbreak, we saw that the senior citizen population was one of the most vulnerable populations to accepting this virus. That's come to light here in Montgomery County as well. Throughout these last several weeks, we've come to learn the same thing, that the senior citizen population is the most vulnerable population that can be harmed by the coronavirus. It's very evident with all the data that we see, the long-term care facilities across the state of Pennsylvania. About 95% of the population that have underlying health conditions are those that are unfortunately passing away from this virus. So we know that's a demographic where we should spend our time, our energy, and our resources protecting. And what I'm disappointed in with this administration is the failure to recognize that and move forward. We're at a stage now where we must move forward. We must begin the process of reopening Montgomery County. We must begin the process of reopening the Commonwealth of Pennsylvania, because we're at a stage now where the cure for this disease, which unfortunately there's no cure for the disease, hopefully we have that in the future, is to lock everything down, shut down our economy, take our children out of school, they're not being properly educated, and all of this combined is having a negative effect on our society. So in this case, the cure, which is a lockdown, is worse than the disease itself, and we have to get past this stage. And the failure to provide these organizations American flags is a signal that there is not an effort to reopen Montgomery County, and there should be. Because I feel if people can golf this weekend, Pennsylvanians were allowed to golf, then they should be allowed to honor our veterans with American flags at cemeteries across this county. So I will continue to try to be a voice of common sense. It's my opinion that the best medication for this virus at this point is common sense. And I'm not seeing the level of common sense that the residents of Montgomery County deserve. I hear you loud and clear. I've heard from thousands of you at this point that you want to reopen. I know many of you are jobless, and it's a very difficult and challenging time for many families across the state and Montgomery County. And we have to start making attempts and show optimism that we're going to get past this and reopen our county. Not allowing veteran organizations to display American flags at cemeteries is not signaling optimism. It's doing the complete opposite. And many of these organizations display the flags at Memorial Day, which is a couple weeks away, it's in the end of May, and Flag Day, which is in the middle of June, on June 14th. So you're signaling to the general public that you're not comfortable with members of the public going to outdoor cemeteries by June 15th. In fact, they won't release these flags, which you already have, until July 4th. This is outrageous, it's un-American, and it's disrespectful. And I will continue to do my best to be a voice for common sense so we can all get through this and get back to a sense of normalcy. Every day I stand here, it's all doom and gloom. We see these numbers. We have 4,800 cases of positive cases since the start of the first outbreak in Montgomery County. I don't know, maybe over 2/3 of those cases recovered from the virus. We don't know that. But we have to provide optimism. We have an obligation to do so as a county leader, and I don't see that happening. So I'm frustrated. The American flag, the failure to distribute them, has pushed me over the top. I think that signals, like I said, to the whole public that we're not going to be open for business by July 4th. Because if you can't go to an outdoor cemetery to honor fallen heroes, how are you going to have reopen your business or go back to work? So I apologize, and again, I'm embarrassed that this has happened in Montgomery County, and I'll continue to be that voice of common sense and urge that the focus from the state government, I see that our neighboring counties in Bucks County and Delaware County are urging the governor to lessen the restrictions, yellow phase of reopening their counties. And they want to reevaluate how many of the long-term care facility positive results and cases should be grouped in with the general population. At least they're making a step to get in the right direction and reopen. We're not doing that here in Montgomery County, and we should be. And when you do make a claim like that, where you say there should be more focus on long-term care facilities and protecting those citizens, instead of all this harm that's caused by the shutdown, people make the claim that you are anti-elderly and that you're not doing enough to protect that population. I think that's where we should be spending our effort, our energy, and our resources, is in the long-term care facilities. And people know what they have to do. If they think they have health conditions that are underlying conditions where they'll have a negative reaction to coronavirus, they should take it seriously. People know, and they have their own individual responsibility to know what they're doing. We don't need a nanny state totalitarian-style government telling us what to do every step of the way. This has gone extremely too far, and we have to get back to common sense basics. And common sense is the key medicine to combating the coronavirus. And with that, we'll open it up to questions.
While you're
Might as
there,
well stay there.
Sure.
you say that the focus should be on long-term care and nursing homes, which seems to imply that you feel that not enough is being done. What do you think should be done?
So the county government does not regulate and does not have oversight over long-term care facilities. The state government does. So I'm disappointed with the reaction and the lack of response from the state government. I don't know how many times we have to show all these numbers and show how many positive cases and how many deaths are coming out of long-term care facilities before the state government steps up and helps them. And they're not doing that. So here in Montgomery County, we have a large population. We have a large population of senior citizens, and we may be the #1 county in the state with the number of long-term care facilities. So it's a challenge here, and I don't see those state governments stepping up to the level they should. So I blame the governor and this Department of Health.
Are there any particulars on what you think could be done, aside from a response? Any ideas of what response was lacking? Or what?
Well, I think it's important to protect the residents. Obviously, they're there because they have underlying health conditions. And also, the employees that work there. We hear that all the time about the employees that work there are also exposed and go back to their families. Perhaps increasing the amount of testing for the employees and the residents of long-term care facilities. Perhaps taking their temperature a couple times a day. There's things we can do to lower the cases and help the residents and the workers in these long-term care facilities.
But you don't know for sure that they're not taking their temperatures, that they're doing things like
I think they could do more, and I think it's inevitable if you're a senior with underlying.
What do you know is or is not being done in these facilities?
Well, that's the whole problem. We have a handful of people here from the county Office of Public Health that have to take away from their normal work duties to find out what exactly the long-term care facilities are doing. The state government should be doing that.
I'm asking Commissioner Joe Gale, who has stood here and given this speech,
Yes.
what do you know is happening in those facilities versus what is not? If you're going to stand here and say, I'm going to be the voice of reason, we're going to have questions for you as to exactly what you know.
Yeah, well, that's the problem. The state government has oversight and regulates long-term care facilities.
You don't know.
I know from what we do when we have a conversation, how many can our county employees reach out to in a day? 5? That's about what they're reaching out to. We have to contact each long-term care facility and find out what they're doing. That's what our employees are doing. Some are testing, some would like more testing, maybe some need equipment to take temperatures. We have more long-term care facilities probably than any other county in the Commonwealth. And they all vary. There's no standard uniform. There's no standard uniform.
Have you picked up the phone and called any of these facilities and said, hey, I'm Commissioner Joe Gale, what do you need, what can we do?
Sure. The question was, have I picked up the phone and called long-term care facilities and asked them, what do you need, what do we do? I just told you twice that we have county employees who are on the phone hours a day handling long-term care facilities and also trying to make visits if they're welcome and open to
So
that.
you have not?
No, we have staff that's doing that.
Okay, so you have staff that's doing that. You're standing here talking about doom and gloom to people that I've interviewed that have lost relatives, fathers, mothers, people who sat there not knowing if their child was exposed when the child doctor exposed a number of people, people who stayed in their homes and feared that people would find out they were possibly exposed when this happened early on.
Yeah.
To them, it's been doom and gloom.
Sure.
It's been doom and gloom to a lot of people. Do you think that it's effective to stand here and criticize all the county employees that are on the phone for hours and all the other people here? To get your hands dirty and to do something.
I just thanked all the correctional officers, and many days you see me at this podium thanking our county staff and the great job and the great work that they're doing. This is a pandemic, a global pandemic. It's not easy for anyone. It's terrible. People have lost their loved ones. My heart goes out to those families. I can't even imagine what they're dealing with. But at the same time, people that should not be affected at this point by this virus are crippled, jobless. I just spoke to a father yesterday on the phone of a 10-year-old boy with developmental disabilities, where he's responsible to educate his child and he's having difficulty doing so. And he's worried that in the long term, this will have a negative impact on his son because he's not receiving the proper education. So there's people that have lost their loved ones. It's terrible. And there's people that should not be affected to the degree they are affected by this virus. And they're struggling as well, and that's terrible as well, too.
So what are you doing to help that father?
I'm trying to reopen and make a step and show optimism that we should head in a direction where we reopen Montgomery County.
So that father that's having problems.
He wants the
with
county
his
to be
child,
reopened.
He needs optimism.
Yeah, he needs prayers, he needs support, and he needs Montgomery County to reopen.
Have you called the governor yourself and said, okay, time to open up?
No, I have not. I hope he hears this today.
What do you think, what steps should be taken toward reopening? What sensible steps do you think right now can be done to start reopening?
Well, I think Delaware County and Bucks County at least are making an attempt, which is to have 2 categories of cases. Positive cases in long-term care facilities, where it's a contained environment, and then the general public out in the community. And go based on where the general public, those numbers, to get to that yellow phase. We have to get to the yellow phase faster, because at this pace, and if we're not willing to distribute American flags at cemeteries, there's no sign of Montgomery County reopening anytime soon. And it's crippling.
When you say you're critical of the health department, what more do you want the health department to do specifically?
The state health
It
department.
sounded like you were critical of the county health department too.
No, I keep complimenting. There's something you're not understanding here. I keep complimenting the county staff and employees that are doing tasks that they shouldn't have to do. They're calling long-term care facilities to find out what resources they need, what can be done to bring down the numbers and help those senior citizens and the employees there. That's not on the job description of our county employees that I'm proud of. That's on the state health department. The state's failing to deliver on that.
So then what more do you want them to do
I think the governor should lead the proper way. And he has been a failure at leadership during this whole process. From the closure of businesses, I don't know how many phone calls I fielded with people asking me what's open, what's not open, what's essential, what's not essential. It was not clear every step of the way with his executive orders. He's a poor leader. He's failed at this. So it's on him to lead the Pennsylvania Health Department in the right direction.
There are women and children and men and church groups and Facebook communities and all of these people out there that are doing everything they can to sew masks, to make surgical hats. They're collecting N95s from their garages. They're making lunches. Tell me some more about what you've done to assist in the pandemic.
Tell me what I've done to assist in the pandemic.
Any volunteering anywhere at food pantries or
Yeah,
making masks?
I'll give you an example. I went to this Skip Back Pharmacy, and I delivered hand sanitizer and various hygiene items to senior citizen communities when this was first occurring here in Montgomery County. I've been very hands-on. I've been very involved, and I'm trying to bring common sense to this. That's what I'm trying to do. So at least I'm speaking out, and I'm a voice for thousands of people. I don't care if they're Republicans, I don't care if they're Democrats, I don't care what age bracket it is. There's a lot of people that share my opinion, and they don't have a voice. I don't know of anybody else saying this. I'm saying it, because it's gotten to the point where it must be said.
I don't think anybody is saying that it's best to keep businesses closed indefinitely. But what is your response, or what is your answer then if this comes back next week with a vengeance and then the hospitals are overwhelmed? I mean, what else do you want to see happen here rather than just open up and see what happens? There's actually nurses that are being laid off. I know nurses that are laid off because elective surgeries aren't being done. That's where hospitals make their money, is with elective surgery. So every other health condition is put on hold, and the whole thing is on this virus. That has a negative effect on people that shouldn't be negatively impacted by the coronavirus. That's the point I'm making. And I'll give you another example. We have a surge capacity hospital, a suburban hospital in East Norton Township. It's never been used. We had a surge capacity facility at the Glen Mills School in Delaware County. It's never been used. So our hospitals have capacity, and it's time that we take the necessary steps to reopen Montgomery County. The surge facility has had patients in it. I did a story on it.
Which surge facility?
One in Suburban.
Okay. Not to my knowledge.
Okay.
And how many was it? One? How many patients did they have? Since you're so well informed, how many patients did the surge?
They had hospital overflow, and they had patients in there for about a week.
How many?
It was less than half a dozen. But to say that it was never used doesn't mean that it was. I mean, the half a dozen, there's still people.
Okay. Well, it's my opinion that the course we're on and this cure is worse than the disease, and it could be handled much better.
Are there any businesses in particular or anything in particular that you see that could start reopening or that should start reopening? Any particular lines of businesses or shops or anything that you think we should start talking about reopening?
Well, an easy one's the real estate industry. I hear from a lot of people that are real estate agents, real estate brokers, and all the hurdles they have to jump and the waivers they have to submit to be able to sell real estate. I consider that an essential service. People need to buy, they need to sell real estate. That's one example. I mean, the hardware stores are considered essential services. It was on the top page, the top fold of the Times Herald last week with bold font that one of the Montgomery County commissioners had to refrain from vomiting because she saw photos of people shopping at Lowe's. I mean, that's not presenting the level of optimism that people are looking for. They want things to reopen. They want to get things moving again.
But in that situation, you said you have faith in the people of Montgomery County to do
Yes.
social distancing. I can tell you, I was in some of those stores and people were not social distancing. They were on top of each other. There were complaints that people were in line for over an hour, shoulder to shoulder. And isn't that how the virus is spread?
And you have the freedom not to go to the store.
I walked out of the store. but
Good.
that's-
Then
I'm
you
not-
did what you felt was
but
comfortable.
It's not about me here. It's about everybody else in the county. It's
Well,
not
I
about
don't believe in
you.
a totalitarian government where government knows best and tells you how to live your life. You did the right thing. You weren't comfortable. You didn't
It has
go.
nothing to do with me. It has everything to do with what you just said earlier, that you have faith in people, that they will be able to social distance in handing out flags, which is when you stood up here.
Yes.
And if you have faith in people that they will do that, we just saw, that's what the commissioner was talking about last week, we just saw a situation in real life and no one was there to stop it because the store was so overrun.
Because people had enough. And if they want to go out and shop, they have the freedom to do so. We can encourage them to wear a mask. We can encourage them to wash their hands. We can encourage them to stand 6 feet apart. When is enough enough? And if someone doesn't want to go to social gatherings or they have mass gatherings, if they think they're vulnerable, they have underlying health conditions, then I think they're smart enough to know they shouldn't do it.
What do you think?
It's common sense.
What this board that you're showing here shows to the people of the county and the area that there is this divide here. Do you think that's productive?
It shows the people that share my opinion that you now have a voice. It's gotten to the point where their voices haven't been heard, enough is enough, and we should be taking steps to reopen. That's not happening. Other counties are trying to do it. They're trying to make steps in that direction, not Montgomery County. So I hear them.
First of all, I just want to personally thank our correctional officers as well. Our correctional officers have dealt with an extraordinarily complicated situation at our correctional facility, and they have responded with amazing professionalism. One of our correctional officers is in quite serious health condition in a hospital right now, and I send him my prayers. I've spoken to his wife several times. So I just want to remind everybody that this is very real. And this has very real consequences for our friends and our neighbors and our families. And I know this is really hard. Everybody is exhausted. We've asked so much of you over these last several weeks. We've had so many businesses that have had to shutter. We have had weddings canceled and high school graduations and religious celebrations. I could go on and on. You've all heard me say it so many times. But these are the steps that we are taking in order to be able to relax the guidelines when it's appropriate to do so and start to move back to a more normal sort of state. And unfortunately, we can all wish. If wishing made it so, I would have ended this thing 8 weeks and 6 days ago. But wishing's not going to make it so. This is an illness. It is caused by a virus that we continue to learn about every week. There is no amount of common sense that's going to make it go away. There's only one thing, and that's science and data. And we have to continue to analyze those things as we get new information. We have to continue to follow an appropriate and stepwise course to keep as many people safe as we can. We have to do everything possible to help our businesses. That's why we are creating a second round of funding of $5 million to help our small businesses. That'll bring us to a total of $6 million, and we hope that, and we plan that there'll be more after that. That is why we've worked so hard to make sure that everybody has enough food and a place to live during this time, and that we've been able to provide testing for people who need it. There is so much that has gone into this. And I know how frustrated so many of you are. I get all those messages too. But here's the thing. We have to stay the course. We're just not quite there yet. And for all the people that go out and do not maintain that physical distancing, we can very quickly end up back where we were a few weeks ago, where we had very serious concerns about our hospitals and our first responders. I just told you a few minutes ago, we still have about 375 people in our hospitals, 1/4 of which need ventilators to breathe. This is serious stuff. And if it hasn't impacted, if the actual disease itself hasn't impacted you personally, well, thank goodness for that, and I am happy for you. But I know that every single person in this county has been impacted in some way, whether financially or because of a missed time with family and friends or other important milestones. It's happening to all of us. But we have to just keep taking deep breaths, be a little more patient, work together as a community, be kind to one another, and understand that this is hard for all of us. And know that we're going to get through this, and we get closer every week. But this is not the time to throw up our hands and walk away in disgust and act like we can just go back to normal and everything will be fine. Because that's not how it's going to turn out if we do that. And with that, I will take your questions.
With that in mind, and one of the points that Joe made is maybe start thinking about opening up some more businesses and allowing business owners to show that they can take precautions, similar to what we're doing with the essential, the businesses that have been ruled like essential. Can you do that? If people feel that there's no action being taken, that we are just kind of waiting and we aren't getting more testing, nobody's seeing anything about a cure. So can we start doing some things like letting business owners show that they can do more?
Well, we're still under the governor's orders, and so that's just the reality that we're in right now. I am in very regular communication with the Department of Health. We are actually pitching to them tomorrow a slightly different way of looking at our data that might be a little more realistic for our area. And as I started saying, I don't know, a week and a half, maybe 2 weeks ago now, that people should be using this time, particularly businesses, to plan how to live with this virus. This virus is not going away anytime soon. I agree with you, there's no definitive cure that's obvious yet, and we're quite a ways away from a vaccine. So in order to make sure that our hospitals aren't completely overwhelmed and we look like a situation that we saw earlier in New York City, or they experienced in Italy, or in the state of Washington in some localities, we are going to have to learn how to live with this virus. And right now is an excellent time for businesses to be making those plans of how can they conduct their business and still maintain the appropriate physical distancing to keep their employees safe and to make their customers feel comfortable enough to come to their business. I think that many businesses have found during this time that they can do quite a bit of work remotely, and we would encourage them to continue to do that work remotely. And when it comes to opening up, physical places, we're going to get there. We are going to get there, but we're not there this week. Hopefully, we'll be there toward the end of the month, where we'll be able to open a few things. But until we can get the governor and the Department of Health to be with us in terms of where we're at and what our data is showing, we're under an order right now.
So then nothing really can be done, the voice of reason standing here, because it's still up to the governor?
Well, right now it's still up to the governor and Secretary Levine. But, we're communicating with them. We have been spending a lot of time, as you all know, looking at our different categories of individuals who are positive. We've invested significant time and efforts going to our long-term care facilities to try to help those facilities out, and we are starting to see those numbers come down. And hopefully some of that is a result of our interventions. So we're going to make sure that they understand where we're at with that particular cohort versus the community at large. I think every person deserves to be counted, but as I've said many times, it may be appropriate to consider the trajectory of disease in those facilities in a slightly different way than we consider the overall community. But those people are going to the hospital, and the staff that work there are becoming sick and going home to their families every night. And I think they deserve to have some care and concern in this. So we can't just ignore it.
It's not about the numbers of people, whether they're in your backyard or in a long-term care facility. It's also what the governor has said is the PPE, getting the masks, getting the gloves, getting the surgical caps. I started hearing from people today that they're making hospital gowns for the patients because the hospitals are running out of gowns for the patients. So how do we get all of that
Right.
done?
We still have significant challenges in PPE, gowns in particular. Gowns are still, I believe, on a national shortage, and everyone is starting to reuse gowns. We've actually recommended to a lot of our long-term care facilities who can't get any of the impervious gowns to start buying the washable gowns, because a lot of the long-term care facilities do have laundry on site. So they're starting to do that and buying them and then washing them every night. So, I mean, these are very real challenges that our healthcare workers are facing every single day.
One question that we've been hearing a lot more of as far as long-term care facilities is not letting the staff leave and keeping the staff, if it's the staff that's possibly bringing in and out, or that's a possibility, to keep the staff sequestered, whatever, quarantined, whatever you want to call it. Is that realistic to even consider?
I don't even know that I can answer that question. You know, it would depend on the facility and those particular staff members and what their personal obligations are at home.
Let me rephrase, is that something you would recommend, that these facilities start thinking about?
I would find it difficult to recommend that. You know, the other consequences of that for those staff members' families are substantial. It's not something I could recommend today. I'd have to have a greater understanding of what they were thinking and how they would manage that.
A couple questions on a different topic.
Okay.
As the election years, there's been some frustration on using some schools as polling locations, especially since parents are frustrated that they can't have graduation.
Yeah. You know what, let me get Commissioner Lawrence up here. He's been in charge of that one.
Okay. All right, so do you want me to re-ask?
If you can re-ask the question.
Okay, so a couple of election questions. One, what do you say to parents who are frustrated that apparently schools are going to be used for this event, but that they can't have things like proms and graduations?
Well, the schools are closed, and that's why the schools are ideal for being used for the election, because there's no chance that anyone who goes to the school that day will be involved in the election process. So I can't speak to proms and graduations, but graduations I don't believe take place within the schools.
Right, they take place in the stadium. That's what we thought. A lot of them take place in the stadium.
Right,
There's
with
frustration that if you can open up the schools for election purposes,
well,
why can't they have these events?
So I'd like to state for the record, though, two of the commissioners here wrote asking for an all mail-in election. This is a pandemic election, so it's not going to be a typical election in any way, shape, or form. Schools, for the election purposes, will be able to provide social distancing there. So because there's gymnasiums and the auditoriums, we can do that. I believe the capacity for that, though, for a senior class to be in the school would be much different than what it will be during an election, where people will be coming in, moving through, voting, and then leaving.
Did you all get a letter from any, or letters from any borough council folks, municipalities that express concern that because they don't have schools in their towns, they are concerned about sending their...
Yes, we have. And there are boroughs and municipalities that don't have schools within them, and they may have to vote outside of their municipality. And I would say again that this is a pandemic election. So this is not a normal election. This is not a perfect plan. This is not what we want it to do. This is what we have to do. We are required by the law to have an election, and we're going to have that election and make sure that we keep our voters and our poll workers as safe as possible, even if that means a little inconvenience that you won't be able to vote where you typically vote or within your municipality.
Was it ever considered the way we do drive-through testing to do kind of drive-through voting, where you could pull up in your car and maybe take a ballot? Or is that not legal?
So there's an election code. There's an election code, and there are laws on how we can handle ballots. So we could not just make a decision to have drive-through voting.
All right, thank you, everybody. We will see you tomorrow.